how existing cardiovascular drugs could slow cognitive decline. Could the key to slowing brain decline already be sitting in your medicine cabinet? New research suggests that widely prescribed cardiovascular medications might be quietly protecting millions of aging brains. But here's the twist. It's not just one drug, but a combination that seems to make the difference. At the 2025 Alzheimer's Association International Conference, Dr. Roshni Biswas from Chicago's Rush Alzheimer's Disease Center revealed groundbreaking findings. Older adults taking medications for high blood pressure, diabetes, and high cholesterol showed measurable protection against both cognitive decline and Alzheimer's-related brain damage. Here's what this game-changing study discovered and why it's sparking heated debates in the medical community. Contrary to what you might assume about dementia treatments, Biswas and her team didn't focus on experimental drugs or high-tech therapies. Instead, they looked at three classes of familiar medications commonly prescribed by general practitioners. 1. Blood pressure regulators, to prevent hypertension. 2. Cholesterol-lowering agents, like statins. 3. Diabetes management drugs. The analysis analyzed medical records of 4,651 adults, averaging 77 years old, a demographic highly vulnerable to cognitive decline. The team counted how many of these three drug categories each person used, not the specific number of pills or dosages. What they found was striking. Those taking all three medication classes suffered slower cognitive decline than peers taking none. But, interestingly, even two drugs offered some protection, while people taking only one saw minimal benefits. But here's where it gets controversial. The study linked these medications to less Alzheimer's pathology in the brain. Individuals using three drug classes simultaneously had fewer amyloid plaques, tau tangles, and other protein clusters associated with dementia. This isn't just correlation. It suggests a biological mechanism where cardiovascular health directly impacts brain health. As Biswas explained, early intervention with a combination approach targeting these risk factors is more effective than a single target strategy. This challenges traditional drug development that often focuses on siloed therapies. Yet another bombshell emerged. 75% of participants took at least one of these drugs, and 90% had prescriptions for them at some point during the study. Yet, physicians currently don't prescribe heart-related medications specifically to protect against dementia. This raises an important question. Could aggressive management of hypertension, hyperlipidemia, and diabetes become the unsung hero of dementia prevention? But the real challenge lies in the study's limitations. As an observational study, it can't prove causation. Researchers like Maria Glymore at Boston University caution, we can't rule out that healthier people might naturally take more meds and practice better lifestyle habits. Ad Dos Santos, an internist not involved with the study, adds, maybe the patients on multiple meds are simply being monitored more closely, which might detect other dementia risks early. Despite these questions, the results align with broader patterns we're seeing. For instance, Novo Nordisk is already testing its diabetes medications, Wegovy and Ozempic, in late-stage Alzheimer's trials. Meanwhile, a recent Chinese study found blood pressure management may cut dementia risk by 15%. This built a compelling case for adopting a multi-risk factor approach to brain health. So what's next? Patients shouldn't self-prescribe these drugs. Healthy individuals could risk unnecessary side effects. But for those with diagnosed hypertension, diabetes, or cholesterol issues, managing these conditions with appropriate medications might offer a dual benefit, protecting both heart and mind. As Biswas notes, this isn't about overprescribing, but about smarter, holistic prevention. This discovery challenges conventional wisdom and invites tough ethical questions. Should we prioritize heart health to protect brains? Could obesity management drugs like Ozempic become Alzheimer's treatments? How do we balance the potential benefits of aggressive cardiovascular management against drug side effects? Share your thoughts in the comments below, particularly if you've seen firsthand how managing heart health impacted cognitive well-being.